drawer test. You scoot over here like this. Anterior drawer tests for the integrity of the anterior talofibular ligament, which sits right here. The individual is in this position so we can stabilize proximally on the distal part of the leg. I'm going to grasp the calcaneus, distract, and then I'm going to provide an anterior displacement like this. The foot needs to be in some element of plantar flexion so that it's more unpacked, open-packed. Okay? A positive sign is more than 5 millimeters of displacement and or pain that's localized right here. That's the anterior drawer test. Taylor tilt test. Let's do Taylor tilt. Taylor tilt test tests for the integrity of ATF, CF, PTF, depending on what amount of dorsiflexion or plantar flexion that we put you in. When we do this test, you can be straight like this, you can be down like this, that really doesn't matter, you can be lying on your side. However, it's easiest for you to apply force. You proximal stabilize, you grasp the calcaneus and distract slightly. If you're in full plantar flexion with a tilt, which brings you into an inversion, that will stress the ATF. Pain will be localized here. If I put you into a neutral dorsiflexion plantar flexion and invert, that will stress the CF, localized pain just inferior to the malleolus. If I dorsiflex you and invert, I stress the posterior tibiofibular ligament or talofibular ligament. Okay? So I get posterior, CF, anterior, as long as I apply this tilt force into an inversion. Kliger's test, also known as an ER test depending on where you put your hand. The Kliger's test will test for two things. If the individual is in plantar flexion and I stabilize proximally and grasp the distal part of the foot, everting him with plantar flexion, I stress the deltoid ligament. Localized pain right here. If I dorsiflex and evert, I'll put stress between the tibia and the fibula, and I will get a positive sign of pain up here for a syndesmotic sprain or a high ankle sprain, the interosseous membrane between tibia and fibula. So that's the Kliger, or the ER test is just putting my forces here or here instead of across the foot. Squeeze test. Squeeze test, the individual can be like this, they can be supine, 90-90, it doesn't matter. The point is that I have to grasp the bones. Fibular head with this hand, medial portion of the tibia with this one, and I squeeze. I work my way down the leg like this until I reach the malleoli. The higher I feel pain as I do this, the more severe the injury. Okay? Nothing, 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 nothing. Pain is a low injury. Pain, 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 pain is a really high injury. That's a positive sign, is pain when squeezing. Thompson's test. Let's have you turn over onto your stomach. Individual bends their knee to 90 degrees. You grasp and stabilize distally. You grasp the calf and squeeze. This is a negative sign that's being shown right now. A positive sign is no movement of the foot when I squeeze, because this tests for a complete rupture of the Achilles tendon. Positive sign, I squeeze, nothing happens.